You know that feeling when a piece of music just hits you, like really hits you? Not just, oh, that's a nice tune, but something deeper. A melody brings back a memory so sharp, it's like you're there again. Or a beat just completely changes your mood. It's this incredible universal thing, right? This power music has. But what if we could take that power, that intuition, and actually harness it, turn it into, well, a clinical tool for real healing and well-being? That's what we're digging into today. Music therapy. And let me tell you, it's way more than just chilling out with your favorite playlist. We've got some great material for this deep dive. We're pulling insights from the Cleveland Clinic on types and benefits, and also an article from Ohio Today asking what makes it so effective. Our mission here is to really unpack what clinical music therapy is all about. You know, the science behind it, who it helps, and it helps a surprising range of people so you walk away really understanding it. Okay, so let's unpack this first bit. We all use music, right, to relax, get energized, maybe even have a good cry. But music therapy, what makes that different? What's the actual clinical distinction?
Right, that's the key question. And the Cleveland Clinic definition really nails it. It's the use of music and our elements of music. Things like sound, rhythm, harmony, specifically to achieve goals. Goals like, say, reducing stress or boosting quality of life.
Hmm.
But the crucial part, it's a healthcare profession. You're working with a qualified music therapist. They plan the session, they lead it. It happens within a therapeutic relationship, all aimed at your specific needs. It's structured.
Okay. Yeah, that structure makes sense. And, reading through this, something that really jumped out at me was that you don't need any musical skill
Yeah.
and that it works for people of all ages. That just felt huge. Like it breaks down this barrier that maybe you thought you had to be musical to benefit.
Absolutely. That's a core principle. It's designed to be accessible. Both sources emphasize it's open to everyone, regardless of their skill level or background.
Hmm.
The therapist's job is actually to learn about you, your needs, what music you like, your history, and then design sessions that fit you. It's about the process, the engagement, not about performance.
That universal access idea is really powerful. So if it's that open, where does it actually make a difference? What parts of our well-being are we talking about?
Well, music therapy can touch on five main areas. Think mental, emotional, physical, social, and cognitive well-being. And this connects directly to what the Ohio article mentioned about music lighting up these really complex brain networks. It engages like pretty much all parts of the brain, so it's truly holistic.
Wow, okay. Holistic makes sense. So can we get more specific? What kinds of conditions or challenges might someone be facing where music therapy could be part of the picture?
Sure. The Cleveland Clinic lists a really broad spectrum where it's used as a complementary therapy. So it works alongside other treatments. We're talking conditions like dementia, traumatic brain injuries, stroke, Parkinson's disease. Uh,
Serious neurological conditions.
exactly. But also things like cancer support, autism spectrum disorder, various mood and anxiety disorders, learning disabilities, developmental disabilities, even managing acute or chronic pain and helping with substance use disorders. It's a very wide net.
And children. Does it work differently for them or support their development specifically?
Oh, definitely. Music therapists work extensively with kids and adolescents. They design sessions specifically targeting developmental aspects, maybe behavior, learning support, or emotional expression. For kids especially, music can sometimes unlock ways to engage and communicate that might be harder to reach through, just talking.
Right, it offers a different language almost. So, okay, we know it helps, we know who it helps, but how? What's the science? What's actually happening in the brain?
The science is pretty cool. The Ohio Today piece dives into this. Essentially, music stimulates multiple brain regions all at once. This helps facilitate healing on different levels: emotional, cognitive, physical. Research actually shows it can change your brain chemistry, like it boosts dopamine, that's the feel-good chemical, and it can lower cortisol, the stress hormone.
Okay, so direct chemical changes.
Yes, and they've used functional MRI scans, fMRI, to watch the brain respond to music in real time. Those studies show music activating areas involved in attention, memory, even motor control. So it's not just a feeling, it's measurable brain activity. It's biology in action.
That's fascinating.
Yeah.
So if that's the why, what about what does a session actually look like? Are you
Yeah.
just sitting there listening to Enya?
Huh. Sometimes listening is part of it, but there's a lot more. The sources talk about different music therapy experiences. They fall into two main types. First, there are active interventions. This is where you are actively doing something with music, maybe creating music composing, writing lyrics, improvising together with the therapist, or singing, playing an instrument, could be guitar, piano, drums, whatever.
So hands-on stuff.
Exactly. Even moving to music counts, from just tapping your foot to more structured movement or dance. The Ohio source points out this active part can really boost self-expression, confidence, and give a real sense of accomplishment. Then there's the second type, receptive interventions. This is more about listening, but it's focused listening. Maybe the therapist plays music live or uses a recording. It could be followed by discussion helping you process emotions that came up, or using rhythm for guided relaxation or breathing exercises or gentle stretching. So it's receiving and reflecting.
Okay, active and receptive. Makes sense. And where does all this happen? Is it just in hospitals?
Nope, it's really diverse. Hospitals, yes, but also schools, nursing homes, senior centers, outpatient clinics, mental health centers, also residences for people with developmental disabilities, addiction treatment centers, even correctional facilities.
Oh.
Yeah, and it can be outpatient or inpatient, sometimes one-on-one, sometimes in groups, which adds that social interaction element too.
And tell me about the process around the session itself. Is there like an intake or assessment?
Oh, absolutely. It's a clinical process. So before you start, the therapist does an assessment. They'll talk with you about your emotional state, physical health, how you communicate, your cognitive function, your musical background, if any, and importantly, any trauma history or triggers.
Right. Got to be careful there.
Exactly. That assessment helps set specific, personalized goals for the therapy. Then, after each session, the therapist evaluates how things went in relation to those goals. They track progress, adjust the plan as needed. It's very goal-oriented.
Got it. So beyond treating specific conditions, what are some of the broader benefits someone might get out of music therapy? Things that maybe enhance overall life.
Yeah, there's a whole range of positive outcomes the sources point to. On an emotional level, it can really help you relax, explore feelings safely, reduce anxiety and depression symptoms, manage stress better, and regulate your mood.
Okay, emotional regulation. What else?
Communication skills can improve speaking, language, social interactions. It can build self-confidence, help develop healthier coping strategies, even sharpen problem-solving skills. And physically, it can actually reduce the perception of pain and improve physical coordination, motor skills, movement.
Movement. How does that work?
Well, they mention a specific technique called rhythmic auditory stimulation, RAS. It uses a steady beat to help people basically retrain their movements. It's particularly helpful for conditions affecting gait, like after a stroke, a TBI, or with Parkinson's disease.
Huh. RAS.
Interesting. Ultimately, all these benefits roll up into improving your overall quality of life. That's the big goal.
Okay, that's a compelling list of benefits. But it does raise a question. Are there any downsides? Any risks people should know about?
That's a fair question. Generally, music therapy is considered very safe, low risk. However, because music can be so strongly tied to memory and emotion, it is possible for it to trigger difficult or unexpected memories. Painful ones sometimes. But this is exactly why that initial assessment is so important. Good therapists are trained to discuss your life experiences, your trauma history, specifically to understand potential triggers. They then tailor the sessions to create a safe, comfortable space for you. The aim is always a meaningful, positive experience, minimizing any risk of distress.
That makes sense.
Yeah.
So this leads to another key point I think we need to clarify.
Yeah.
How is this clinical music therapy really different from, me putting on a calm playlist on Spotify when I'm stressed, which, let's be honest, a lot of us do?
Right. And that's a really important distinction the sources make. They differentiate music therapy from therapeutic music. Music therapy, like we've been saying, is a healthcare profession. You've got a qualified therapist, specific individual goals, a structured plan. It's an intervention. Therapeutic music, on the other hand, is simply using music to help you relax or feel better in the moment. It doesn't require a therapist. Listening to that calming playlist, that's therapeutic music. It can be helpful for sure, but it's not music therapy. The sources even give the example of a nurse playing music for a patient. Beneficial, yes, but considered therapeutic music, not music therapy, because it lacks that trained therapist, the assessment, the specific clinical goals.
Got it. The therapist and the targeted goals are the key differentiators.
Precisely.
So maybe some listeners are thinking, wow, this sounds amazing. I'd love to do this. For someone intrigued by the field, what's involved in actually becoming a music therapist, say, in the U.S.?
It's definitely a dedicated path. It typically starts with getting a bachelor's degree in music therapy from an accredited program. The American Music Therapy Association, the AMTA, has a list of approved schools.
Okay, so a specific degree.
Yes, and the coursework is pretty broad. You study music, obviously theory, performance, but also music therapy techniques, psychology, biology, behavioral sciences, human development. It's quite interdisciplinary. Then comes the clinical training. It's substantial. You need to complete 1,200 hours, which includes a supervised internship, usually in a healthcare or educational setting, real hands-on experience.
1,200 hours. Wow.
After the degree and the internship, you have to pass a national board certification exam. That's run by the Certification Board for Music Therapists. Passing that earns you the credential, MTBC, Music Therapist Board Certified.
MTBC. Okay.
And it doesn't stop there. You need ongoing professional development to maintain that certification. Plus, depending on the state you work in, there might be additional state licensing requirements. The Ohio Today article specifically mentions their university's program, which started way back in 1951. It highlights the need for rigorous academics, extensive clinical training, and even research opportunities to really prepare therapists well.
It really sounds like a serious, demanding, but potentially incredibly rewarding field.
I think so.
And so wrapping this up, it's really clear music therapy is so much more than just listening to nice sounds. It's this blend of art and science, right?
Right.
A really rigorous, evidence-based way to tap into something fundamentally human for healing.
Exactly. It's personalized, it's scientific, and it leverages that deep innate connection we all have with music for growth, for healing, for just a better quality of life. It shows how powerful that connection really is.
Yeah. And maybe a final thought for you, the listener, to chew on. In our search for ways to feel better, solve problems, how do these structured, creative approaches like music therapy offer something different? Something maybe traditional talk therapy or medication alone doesn't quite reach? Think about your own relationship with music. Could it be more than just background noise or entertainment? Hey, if you're thinking about this for a child, the Cleveland Clinic piece suggests starting a conversation with your pediatrician. It's a good first step.